So telehealth was sprung onto us at the beginning of COVID, and we all became experts overnight, right? We had to. We didn't have an instruction manual. Some people had engaged in chronic care management, so had a little bit of experience doing it, but most of us had no clue what we were doing when we started out with telehealth. And now the patients have come back for the most part, and the question is, do you think telehealth is going to continue? And my personal opinion is yes. I think the cat's out of the bag, and I think it's here to stay. I think patients like it. I think it makes for good medicine. It's cost effective right now. It's become to be expected. I live in the Northeast. We get a lot of snow. We used to have to close our practice for 3 or 4 days every year. It was a total wipeout. We couldn't see patients. Now we can reschedule them for telehealth visits, and I can do them for my study at home. For my snowbird patients who go to Florida, they would disappear for 6 months or longer. Now I have an option to have a touch point with them while they're down south. And some of my patients never come back from their second homes. I don't know that COVID-19 is completely over. There may be some spikes here and there, depending on where you live and what the various rules are going on in your region. And there may be more restrictions, there may be more scares for patients, and they're going to want to continue with telehealth visits if possible. When you read the various articles in urology practice management and reviews in urology, for the most part, patients like telehealth visits. They're actually pretty high in satisfaction. We are still able in our hospital to do inpatient consults. So where the emergency room doctor used to call me up, curbside me, and I got paid nothing for giving him advice on the phone and taking all the risk. Now the phone can be brought into the room. I can talk to the patient directly. I can render my decision on whether I have to come in that night or not. I can dictate a note, and I can actually bill for it if I've done a video visit. With my PA, my nurse practitioner, who help us with rounds, sometimes our list can be very voluminous. We don't have to walk into every single patient's room. Again, with the advantage of telehealth, we can actually do rounds through the cell phone. And then when patients call in the evenings and the weekends, those all used to be freebies. Now they're not. You document a note and say what care you've provided, advising them to come to the emergency room. They've got nausea, vomiting. I think it's a stone. Or, yes, Ms. So-and-so, I think you've got a routine urinary tract infection. I'm calling in some macrobid. All of that is now billable. And depending on the size of your practice, you can get a lot of phone calls at nights or on a 3-day weekend, like just what happened to me over July 4th. So what can you do to optimize the visit? The first and foremost problem with telehealth is the technology. You've got to make sure you've got the technology set up in your office. And most importantly, we're dealing with a lot of elderly patients. You have to have staff that works with the patient when the visit is scheduled to tell them exactly how it's going to go, what they have to do on their end to make sure they're in a place that's quiet, they've got good internet connectivity, they know how to adjust the volume on their computer, they know where the camera is located on the computer. You want to schedule your telehealth visits during a dedicated block of time. Don't try and intersperse it with inpatient visits. It'll never work, because you never know if a patient's going to run late, have more questions, show up late, and then you're late for your telehealth visit, and then they think they're having problems connecting, and the whole visit dies. Prep. You got to prep the charts with all laboratory results, pathology, radiology, operative notes, whatever you need. Again, this is not like having the patient in the office that you can say, sorry, Mr. Smith, don't have that bone scan report. Give me a few minutes. We're going to go call the hospital. We're going to get it. That doesn't work in a telehealth visit, because a telehealth visit, you have a very defined period of time, 10, 15, 20 minutes. Those charts have to be really, really, really prepped. Also, make sure that you don't have to do a physical exam. If you need to examine the prostate, they have to come in. There's no app yet for prostate examinations on the cell phone. Make sure that you don't have to do a urinalysis, you don't have to do a bladder scan, Uroflow, etc. Video visits, it's much better to do a video visit than an office visit. You still get to make eye contact, better patient satisfaction from all the surveys, and better billing. The patient, they need to have family members available if necessary. And that can be a good thing to have a patient's family member there to help out. If they're in a nursing home or facility, and I've had this happen, they park the patient with Alzheimer's who's nonverbal in front of the computer. That doesn't make for a very good telehealth visit. There's got to be a nurse there who knows the patient, knows the medical issues, and can advocate for the patient. You want to get them to log on about 10 minutes before the visits. They're all set up. Make sure their computers are working. They've got good audio and video connectivity. For the doctor, doesn't work to have one computer, I found. You have to have two. You've got the one computer where you're looking at the patient, but you have to have another computer where you've got all of their results that you can refer to, the laboratory values, x-rays, pathology, whatever. You can't flip back and forth. It doesn't work. It helps to review the chart in the morning, tell your nurse or your MA, hey, we're missing such and such. I've got a telehealth visit today. Can you go ahead and make sure this is in the chart? Make sure you're in a quiet room. You want to preserve confidentiality. You want to reduce background noise. Also remember what the patient's telling you. Some of these things are confidential. Recently in our office, one of our doctors did the ultimate no-no, tried to schedule a telehealth visit between patients in kind of a common area. And the topic was erectile dysfunction. And the first thing the patient says was, so doc, I'm more of a stuffer than a poker. You understand what I mean? And the nurse in the background says, oh my God, I can't believe you just said that. The patient goes, wait, how many people are listening to this, doctor? Who's around there? Aren't we in a confidential area? So make sure you're in a confidential room. The patients can see you, look professional, don't be distracted, don't be looking at your cell phone. All eyes on that patient, just like they would if they were in the exam room. And you've got to stay on time. You've got to stay on time for the visits because the patients will leave before you can connect with them. Again, focus on the patient, engage the family members, look at their surroundings. That may give you some insight into the patient. You can remark, are those your grandkids there? At the beginning, I know a lot of doctors in my group, and some doctors still have trouble engaging the patient. Sometimes these telehealth visits last 2 to 3 minutes. That's not the goal of the telehealth visit. So use the surroundings of the patient, use the family members, engage the patient, make sure they're engaged with you. You can hear what they're saying. If you can't, have them repeat it back to you. Make sure that they're understanding what you're saying. Again, don't run late. Schedule the most appropriate amount of time based on the visit. After the visit, make sure the follow-up tests and follow-up visits are scheduled right then and there. Have your MA or nurse call the patient back and say, Mr. So-and-so, we're scheduling the CAT scan, we're scheduling the ultrasound. Do this immediately. The patients are right there. They've just hung up with you. Don't do it a couple hours later. You may not get back in touch with the patient. The caregiver may be gone, and these tests may not happen. If you're unsure based on the televisit that the patient has not understood you, doesn't understand everything that has transpired and what they're supposed to do, send them a letter or a copy of your office note. Easy enough to do right from your EMR. That way you know that they're getting something, they understand what they have to do. So to conclude, many patients now have come to prefer telehealth over inpatient visits. It's here to stay, at least for now. Question is, will the reimbursement stay or will it decline? Helps keep the sick patients out of the office. It can expand your practice, expand your reach. Some patients who've decided to relocate, leave the area, move to Florida, they've been your patient for 20 years, you can still care for them. You can arrange for the tests to be done wherever they're living, and they can still be your patient on telehealth visits, and you can maintain that continuity. Allows for evening and weekend billing of phone calls. Can help with ER visits and rounds. Also allows more flexibility for the doctor if you are on a productivity model and you want to do some telehealth visits from home after hours or on a weekend. You can do that if you want to boost your RVU numbers. These visits have very low overhead, and ultimately it's good for the practice, it's good for the patient, and it's good care.